Fever a little bit, you rush to the doctor. Fever a little bit, you rush to the doctor. It's not absolutely necessary as long as you abide by common sense. Of course, you have to recognize when it is serious and when it is not serious. Okay, so I've just chosen a few topics only because there's time limited, so we cannot do so many topics. So these are the topics I'm going to talk on: respiratory infections, hand, foot, mouth disease, because this is very common and people ask a lot of questions on this. Gastroenteritis, which is Ceret-Beren, and then urinary tract infection, again very common but not easily recognizable, and then allergies. Okay, so we will talk about the respiratory infections dulu. Practically every child in their young life under the age of 3 will have cough, cold, fever, flu, you know, and then of course some will be worse, some will be just mild. Basically there is an infection of the mucous membrane along the respiratory tract, right from the nose, the throat, the vocal cords, the bronchus, and the lower tree and the lungs. Depending upon where is the infection, then we give a name. So you will hear the doctor talking. My phone, sorry, yeah. Just excuse me a minute. Dah, silence. Okay, sorry. So you'll hear the doctor saying patient has got rhinitis, pharyngitis, tonsillitis, bronchitis, you know, laryngitis. These are all names given, but it's all on the respiratory tract. You see? So what happens when the virus infect the mucous membrane? It produces an inflammation. Then it triggers the production of mucus, and then runny nose will be there, or even if the mucus become very thick, then it become blocked nasal congestion. The throat is very painful. The child starts coughing. And then in the beginning, majority 90% would be due to virus, but they can develop bacterial infection after that. So the common symptoms in the beginning would be fever. The temperature can be just mild, 38 if it is mild infection. It can be going up to 39, up to 40 even. And the child has not willing to suck the milk, decreased appetite, not eating, very tired, lethargic, and general feeling of illness. And sometimes, of course, children cannot complain, but they do have aches and pains. They have headaches as well, but they don't know what to tell you, or rather they cannot talk, is it? And so they just become very cranky, uncomfortable, not able to sleep, and so as a result, the whole family cannot sleep. I already described the nasal congestion, feeding problem. Then because of the feeding problem, sometimes the child will be dry and the mucus from watery becomes thickened, and then the feeding problem, the child is not able to drink, again is dehydrated, and even vomiting, profuse vomiting or once in a while vomiting. And difficulty in breathing, it can be just like that, slight difficulty in inhaling, but it may be noisy breathing, and it can be even like wheezing like that. Or in the case where the vocal cords is infected, then they can have stridor. It sounds like that. That's a severe type already lah. And if it is really blocking in severe viral infection, after that it will be complicated by bacterial infection. They can be sort of like the airway becomes so narrow, they cannot breathe, and therefore the oxygen supply to the lungs is very poor. Then they can even become cyanosed, bluish in color around the lips. Okay, let's see now. Now, as far as the treatment is concerned, a simple thing, for if the child is not very ill, we make sure the child have enough fluid. That means if the child cannot drink thick milk, the usual concentration, give more diluted milk. Then we spray the nose with normal saline only, which is just water with a bit of salt, then which is sterile. Then we clean the nose so that the child can start breathing. And if the child is wheezing or having stridor, very thick mucus, then of course you need to take the child to the hospital for nebulizer, and sometimes we even suck out the mucus when the child cannot cough out. Now adults is easier because we can all force ourselves to drink, well hydrated. When we cough, we try to bring out the mucus ourselves. But the children just go like that, and they cannot cough it out. Right, so from this respiratory infection, they can have complication with bacteria infection, like I told you just now. It can be in the ears because, as you know or may not know, the ear is connected to the back of the throat, and so there is a tract coming from the throat to going to the ear. So that can be blocked by the mucus, and the bacteria can be trapped, and they grow infection in the ear. So that's what we call otitis media. So the child will be more cranky, and sometimes they're just pushing one ear or scratching one ear more than the other. So this one need to be attended to. The child has to be given antibiotic. Sinusitis, sometimes when the nose is blocked already and the sinuses are blocked, usually these are bigger children because the sinuses are formed much later in life, not in the first 1 or 2 years. You see, they form a bit later, about 4 years like that. So they have sort of greenish mucus coming out from their nose. So this one too, again, they need antibiotic. But in the first case study, when I was talking about the initial infection too, it's just viral. So your doctor probably will not give any antibiotic to the children. They will just give them the simple treatment to relieve the blockage and to dilute the mucus. Pneumonia is actually infection in the lung. That means, you know, the child has got cough, cold, flu, viral infection, then come across somebody who is coughing and has already infected lung, is infected by bacterial infection. When that person cough and the child inhale the bacteria, it's very easy to stick to the mucus and get infected in the lungs. Okay, so that again needs treatment, real proper treatment with antibiotic and other measures. Okay, so this is how the child will look like when the nose is blocked, the airway is narrowed. So trying to take in more air, so they breathe in through the mouth because the nose is already blocked. You see, so that's what the child do. And then when we treat the child in the hospital, we have to give that mask. We call this nebulizer. We put a lot of water or normal saline. Maybe sometimes need some medicine to open the airway. So we give the oxygen through that, and there will be some temporary relief. Maybe if the child is severely affected, we may give it every 4 hours, and then associated with chest physiotherapy as well. If you are going to take home the child is not so bad, the doctor may just give you one sort of portable system like that, which you take home and then you apply it to the child yourself. Is it? Okay, we go on to the next topic. This one is very common, a lot of questions. People come very worried with children who don't want to drink their milk, who crying, cranky because of the pain. So hand, foot, mouth disease. This is very common because now a lot of our children are staying in nurseries and kindergarten, so they infect each other. See? So the infection is a viral infection, can be the Coxsackie virus or some other viruses, and it is infected through the droplets. So if the child who is affected by the hand, foot, mouth disease, by that particular virus, she drinks from a cup or from a bottle, or wipe the mouth and leave the towel there. Another child comes along, drink from the same cup or the same bottle, and also, or use that towel to wipe his or her mouth, can easily get this. Or they're nearby, they play together, then cough, 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 they infect the other child. So it's very infectious. Now, very easy to diagnose. Number one, when they refuse to feed, you try and look into their mouth. I mean, you just open the mouth and see. You can see the ulcers can be around the lips here, on the tongue, and also at the back of the mouth. On the palate. And they also associated with rash. You can see the rash is actually, what did I do? I didn't show the rash yet. Okay, sorry. So you can see the rash. Tak ada. Tak apalah, you can see the rash on the toe, the rash on the fingers, the web of the hands, the sole of the foot, and the ulcers in the mouth too can be everywhere. I didn't have one that shows actually on the palate. The palate, the tongue too is easily seen. You can just put the torchlight and you can see. Now, if the child has got just a little bit of fever and still able to drink a little bit, you don't have to rush to the doctor. All you need to do is give some diluted milk, water to drink. Air kelapa muda is one of the best drinks that you can give the child. It's quite nice and and well hydrating. So when you give a lot of fluid, when you give a lot of the child is well hydrated, makan don't worry yet, you see, because they don't become so hungry or starved. Mana tu? Okay. They don't start starving so soon, you see. So 3-4 days, then the ulcer is less painful. You can buy sort of spray or local application. Of course, if you go to the doctor, this is what the doctor will give you: some spray to the mouth to numb the pain, or some local application. And the ones on the rashes too, you just need to put calamine lotion. That should be enough. So that's hand, foot, mouth disease. If your child has got this condition, then you have to isolate the child at home. Maybe you don't send the child to the nursery for a few days because the other people might get affected. But I always tell parents the condition is already spread in the school, you know, to be sensible. But if I say that you can still go to school, I'll get shut down by the nursery operators and by the schools. And at home, similarly also, you have to mix around with the children. Only thing, you wash it, you make sure that the child wash the hand, don't use towel, don't use cup, interchange with all the rest of the family. But when you're living together, there's no way that you can escape it that much. But after some time, the bigger children will form antibodies and they don't get easily affected by it. So it's only the young child, usually the infants and the toddlers, that they get this. Bigger children occasionally get it, but they can tahan the pain, you know, and easy to treat them. Okay. So then we talk about gastroenteritis. This is but mostly it is viral infection of the stomach and the intestine. So the first they will get vomiting and diarrhea. Then the diarrhea can be ranging from just soft stool to watery, profuse stool 4-5 times a day, or even can be more than that. And then they have abdominal cramps. They're not eating very well, but they are thirsty, they are hungry, they want to eat. But because of the abdominal cramp and the vomiting, then they refuse to eat. Then of course most of them will be associated with fever. And because of not eating, not drinking, abdominal pain due to the abdominal pain, and also losing fluid from the vomiting, losing fluid from the diarrhea, the child will become dehydrated. So if you see that your child is already sunken, then you have to go and see the doctor. Otherwise, at home, if the child is still drinking milk mostly, just stop the milk completely. You can give diluted milk, or sometimes if the diarrhea is very bad, you can go and buy those lactose-free milk for the infant, you know. But for 1 or 2 days, you can give air kanji, you can give any other liquid, air kelapa muda, all that, no problem. You only want the child to be rehydrated so that the fluid that is lost from the vomiting and from the diarrhea can be replaced. And you want your child, as long as your child is well hydrated, the fever will come down. Maybe you might want to give some fever medicine. Most of the time, you don't require treatment. But if the diarrhea is prolonged and the vomiting is prolonged, of course you need treatment. First and foremost, the doctor that will give anti-vomiting. Because once you stop vomiting, you can start drinking. If necessary, you can give the anti-diarrhea. But if the diarrhea is just soft stool 3-4 times a day, I don't bother giving anti-diarrhea. And this condition, usually they get better within 3-4 days. Only the really bad one becomes dehydrated, then only they need to be admitted for the IV drip. But generally, you can treat the child at home. Next, we talk about urinary tract infection. This again is one of the commonest infection in childhood. Next to the respiratory tract infection, this is the commonest infection. Urinary tract meaning the kidneys, the ureter. I haven't got any diagram here. I didn't have the time to draw. That we have 2 kidneys. Then you have the ureter, which brings down the urine to the bladder. Then the urinary bladder, and then you have the urethra. The infection can occur at any place along this urinary tract. But most common is actually, kalau boys, it is at the penis, then it can go to the urethra, then the bladder. Girls, straight away, urethra goes to the bladder. But if the infection goes on for a long time, or the bacteria is very powerful, but strong bacteria, then the infection can go up to the kidneys. Then it will be worse because the fever will be very high, ordinary antibiotic and fluids will not help, and the child will have to be admitted to the hospital. So these are the things that they will present. If you have The bigger children who can tell you that they have pain on passing urine, then it's easy to make the diagnosis. Say pain or sakit, kan, it's easy. But sometimes the child cannot talk. So you just see that they are crying, when they want to pass urine, they cry. The bigger children again will have increased frequency. Sekejap-sekejap nak pergi bathroom, toilet, nak pass urine, and they feel that there's not much urine yet in the bladder, but they feel like urgency. They want to pass urine, but when they go to the toilet, there's just a few drops or a few mils of urine only. And the bigger children who are already what they call toilet trained, say they're about 5-6 years old, they don't wear pampers to bed anymore. Suddenly, they start bedwetting again. Or school-going children, 6 years old, 7 years old, they have been dry for so long, suddenly they start bedwetting. So that's again a sign of urinary tract infection. Abdominal pain, the severe one can have vomiting, and 80% of them will have fever. What else did I write anything or not? So when you see the child like that, you just collect the urine in say clear bottle. Say if you have a jam bottle at home, wash it clean. Then you make the baby or the child pass the urine into the bottle, and you look the urine what do you call that in front of the light. If the urine is slightly yellow, that's normal color. If you are dehydrated, it is brownish, macam bulan puasa kan. When we pee in the evening, the urine is brown in color. So, but the brown in color alone is okay. It's not infected. It's just that you are dehydrated and not enough water. But the urine should be clear with slightly brown or slightly yellowish. But if you shake the bottle and there is like a sand, like there's some turbidity in there, like pasir-pasir inside, then that could be urinary tract infection, because the bacteria plus the slough from the urinary bladder gives that kind of consistency. If the infection is very bad, severe, it's gone on for a long time, then it may even sorry. Sorry, I don't even know how to turn off my phone. Sophia, I think she's looking for the place. Sorry. If the urine is very infected and the bacteria is very strong, it can even look like pus, So, and it's very smelly. The smell is different. Ordinary urine also smell a little bit, but children's urine usually not that smelly. But when they have urinary tract infection, it's very smelly. And occasionally it can be blood stain. So like boys, when they go to the toilet, they're already independent of their parents. They go to the toilet. Sometimes they don't tell the mother, but they're big enough to describe. They say, "Oh, my urine is different color, reddish color." And so in this, and those who are the boys who have the infection of the tip of the penis, then it'll be reddish and swollen, and they have got severe pain on passing urine. Now, when you take the patient, the child to the doctor, they will need a urine sample. So the child will have to be well hydrated, lots of fluids to drink so that we can collect the urine. So belum lagi. So anything else we need to talk? Yeah, urine infection, generally speaking, 99% is due to bacteria. So we will need, after checking the urine, after examining the urine, we will need to give antibiotic. But the most important thing is still the fluid. My description to a lot of my parents is that I said, if the urine is dirty, you need to give a lot of fluid. Even if the child is vomiting, try to encourage clear fluids, because the more you drink, the more urine you'll produce, and then the more the flow of the urine, so some of the bacteria will get washed out. Whereas if the child is dehydrated, the bacteria, he doesn't pass urine or she doesn't pass urine that much, then the urine is stasis in the bladder. The bacteria grow and grow and grow until there's a big colony there. So even if we give antibiotic without drinking a lot, it still doesn't cure the child. So most important, fluid. If the child got fever, a bit of fever medicine, and then after that the antibiotic. But usually before giving the antibiotic, we need to check the urine, because we cannot be throwing antibiotic to every child that's got fever. Yeah. Okay. Now we talk about allergy. Allergy ni, the child can be allergic to all sorts of things, right from baby, newborn, to, it gets sort of quite severe during the first 1 or 2 years, and then usually by the time they are about 6-7 years, it become less and less and less already, So they can be allergic to food, dust mites, animal fur, insect stings, pollen, grass, chemical, anything they can be allergic to. Usually there is a genetic element. It's not 100% genetic, but there will be, some history, say, the father or the sister or the mother, the grandmother, somebody has got some form of allergy, some form of eczema. So the environment, whatever it is, either the food coloring, or the animal fur, like they have got cats at home, mosquito or insect stinging them, or they play in the grass and suddenly they come back with all swollen and rashes. So this, the allergens, we call it, react with the immune system of the child, and it produces the eczema and the swelling. Yeah? So you can have different types of rashes. You can rash or urticaria and eczema. So is it about the same, doctor? Yes, it is about the same to describe it. But urticaria are those raised lesions. You can feel it, reddish, and what do you call that? Usually is itchy, yeah. And the other eczema, it can be just sort of discoloring of the skin, a bit itchy, a bit of rash. It can be in patches. Rash also, if it is contact eczema, it can be only in the area of contact. If it is actually something you eat, it can be generalized because it goes to the blood and it goes to the rest of the body. Whereas subcontact is just at that particular area, like insect bite or whatever. It is just that particular area that you have the rash. You can have also local swelling, and then if you are like allergic to, and if you are allergic to like pollen, or like some people are allergic to really dust, if they enter a room that's full of dust, then their eyes will start watering, and then what you call runny nose, and the eyes become puffy. This is the severe type lah. Otherwise it's just watery eyes, watery nose only. The severe types, and they'll have puffiness and they've got breathing problem. And of course, again, those children who are already asthmatic and they're not asthmatic at that point in time, but they come across the allergen, something that causes them to react, then they can suddenly be triggered with the asthmatic attack, coughing and wheezing and difficulty in breathing. I show you some pictures. This is rash in the in the infant, the very young child. This is very common. All those who have got children already, you realize that, within the first week, second week, third week, you already have got your babies. The cheeks are all reddish, and then the neck around here is very reddish. So this is just usually is what do you call that? Allergic to the environment, allergic to what do you call the heat. Especially if the baby is breastfeeding. So when the baby is breastfed, the baby is sitting under the mother's breast. So it's hot and sweaty. So the mother's sweat is mixing with her sweat or the baby's sweat. And later on, the baby will start to regurgitate the milk. And with the milk, is sort of mengalir dekat pipi dia kan. So you need to wipe all those things. If you wipe like this, then of course, that stale milk will go onto the rest of the cheeks, you see. So your cheeks are full of rashes here, and then of course the dribble underneath the neck, because the rest of the body is clear. So it is not milk allergy, all right? The baby is not having milk allergy. It's only if the baby has got the whole body, the other rashes as well, then you might say that it is milk allergy or whatever the mother has taken. For example, the mother took some prawns, some seafood or something. Then if there is the genetic portion of the eczema is there, then the baby may develop the rash all over the body. But if it is just the cheek and the neck, this is usually because the milk and the heat and the sweat. So it's very simple. No need for any medication. You just wash the area with a soft towel and water, and make sure it's all dried up after the feeding. And after feeding, don't wipe just with towel like this. You must put water on the towel, squeeze it dry, then you wipe the cheeks and the neck. So that will clear up the eczema there. The other thing is that babies also can have what we call that cradle cap. See on the head there. I don't know whether you can see it or not. This dry rashes, and then accumulation of dried skin and other things. We call this cradle cap seborrhea. So this one too, again, if you allow it to accumulate, it can become a thick area of scab on the scalp. So this one too is again is quite easy to look after. I usually advise the parents actually you apply baby oil on that in the morning, maybe on waking up, apply the baby oil, let the baby oil remain on the head, but you must just a thin layer, not that much. Then you rub the scalp on the scalp area with the seborrhea too, with the palm of your finger, not the nail. Don't allow it to scratch. Just rub it like that. Wait for about an hour or so. Then bath time, you wash it away with warm water. After the bath, no more oil on the hair, because the oil will attract dust to the head, and more dust will settle on the hair, more seborrhea, more everything is more and more and more. So we try to avoid that. But it takes time. I mean, if it is a bad seborrhea, it will probably about a week to 2 weeks before you can clear it up. It's not immediate. Okay. Now, this baby, yes, this one is probably allergic, that is actually either from food or playing with the cat, because the whole body is affected with the rash. So it's like a fairly severe sort of eczema. Some contact eczema on the palm, if they've been touching something that they are allergic to, then then you can have the eczema on the palm. But generally speaking, most of the eczema is actually on the flexural areas. That means where the area is flexed, because ada a little bit of sweat or whatever, more action along that line. So you have the rash on the flexural area, at the back of the knee, in front of the elbow, or in the neck area, or at the buttock area. Then, so that one is like insect bite or grass. You know, it touch the skin of the baby, so it gets swollen areas on that one. And the other one too is more what we call like urticaria. Sometimes if they ate something that they're allergic to, they can get the urticaria. Apa dalam bahasa Melayu apa, geligata or something like that kan? Yeah. So, then this one is the one at the bottom here is little vesicles being formed. These are the rash. Again, it can be contact. It can be also allergic to certain food. Okay, I think generally speaking, my talk is very brief. It is done already. Any question on any topic later on, you can ask me. But just as a reminder, because now a lot of people don't want to immunize their baby, they let them get all sorts of infection. So as a reminder, ensure your babies are vaccinated. So, you know, otherwise the other diseases more severe than what we are talking about will be too. Kan? Recently we had about diphtheria and whooping cough and measles and all sorts of things, because mumps, you know, these are all vaccinated diseases. I mean, you can protect your children through vaccination. Right. So that's okay.
Thank you. Thank you very much, Dr. Indon. I'm sure all of you have benefited from Dr. Indon's talk. I'm sure all of you have benefited from Dr. Indon's talk. I mean, we in Malaysia are very lucky because as parents, we are not sure when your child is sick, you straight away either bring to the GP or bring to your covered by panel, you bring to consultant pediatricians in any medical centers. But this is not so in some developed countries like the UK. I mean, everybody is registered under the National Health Service, so you cannot have easy access to the GPs. You need to make appointments. So that's why in the UK, a lot of the parents take the initiative to know more about their childhood, about childhood diseases, so that they can be empowered on what to do with their children. So this is one of the steps that you can empower yourself. In talks like this, I'm sure all of you have educated yourselves about things to watch out when your children have fever. Like Dr. Indon said, does not mean when your child is unwell, you just have to go running to any GP or any pediatrician. So are there any questions? Dr. Indon has finished on time. She's supposed to finish at 10. But unfortunately, our third speaker, Dr. Zarina, who's supposed to talk on prophetic medicine, has to emergency because her uncle just passed away. So I think we will extend the Q&A so that we can benefit more from these two pediatricians who are here this morning. Are there any questions? Yes, Ili.
Assalamualaikum.
Okay.
I do want to know a little bit
That-
more about the optional vaccine, which is the pneumococcal. Like, because since it's optional, it's
Mhm.
not something that is compulsory. I was wondering, like, how advisable is it to be? And I understand there's like two options as well. One covers like 10 diseases, another is
One like what?
one covers like 10 diseases and another covers 13, if I'm not mistaken. So I was wondering, like, what kind of pneumococcal diseases, pneumococcal vaccines there are, and which are the most advised to take.
Okay.
And my baby is 5 months.
5 months, huh? So it is very expensive, like you said just now. One shot is about 250 ringgit, and usually if the baby is under 1 year, we advise 3 shots or 4 shots, and that will set you back to say about 1,000 ringgit, kan? The age we recommend for the immunization is from the age of 2 months to 9 years. Even we adults also we have, but we are infected by different category of pneumococcus. So the pneumococcus, there are many varieties of them, but they have done studies already which are the common pneumococcus. So the Previna 13 has got 13 virus bacteria. So this is not the whole bacteria; it's parts of the bacteria that they have cultured. So so they studied which one is more common, and they take those to make the vaccine. You see. So the other type, so that is the Previna, one company that makes that. Is it? The other company that makes it is they call it Synflorix. So that one they have got 9 types of bacteria. So but cost is about the same. Now the company will always tell you that you must give 4 shots. And they said 9. I mean from the age of 2 months onwards. So depending who your pediatrician is. They will advise you after the first DTP vaccine too, you give your pneumococcal vaccine. Because of the expenses and also the disease is not so frequent, the disease occur in 1 in 5,000 children. But the thing is, we never know when we are lucky or we are unlucky and that one happened to be our child. Is it? If you get this disease, it can be very severe. I personally looked after one patient about 10 years ago who was about 2-3 years old, who has been having usual cough, cold, flu, slight fever. Mother give paracetamol, the doctor give a bit of cough mixture. Then at 5-6 o'clock she went to the Klang hospital. The doctor looked at her and said, no, we cannot treat here. So sent to SDMC. That child arrived around about before 11 at night. Arrived in ICU about 11 o'clock. I came within half an hour, I was there already. By 12 o'clock, the child was very bad. By 1 o'clock, we have to ventilate the child. By 3 o'clock, we cannot sort of sustain the child on oxygen. By 4:30, the child died. So it is that severe. So similarly, other pediatricians got other experiences. So, it can be devastating if your child happen to have the condition. But as I say, it is not very common. It is only 1 in 5,000. But you never know, is it? So usually I tell parents, if you can afford it, then you start giving, as early as 2 months. But if you feel that you want to complete the compulsory immunization first, because some of them complete so many needles, Dr. Indon, every month got injection. Okay, we won't do it now yet. We finish the compulsory immunization by about 5 months or 6 months. So after that we can give the pneumococcal. But if you still don't want to give, provided your the child's stay in the nursery that is very clean, hygienic, and the environment is quite good. The minute your child is ill, you bring to see the doctor, and the doctor will then check and see if it is necessary to give antibiotic or not necessary. Then you can delay it until the child is 1 year plus, or 2 years, or even 3 years. So So I do not force my patient to have the compulsory immunization. But of course, different pediatricians have got different opinions. So this is my opinion as an old pediatrician. So because you see, when the child is older, they don't need that much vaccine. Say if the child is above 1 year, say nearly 2 years already, all they need is 2 doses. Because the body is able to make the antibody very fast, very rapidly. So you give one vaccine, 2 months later you give another vaccine, that is enough. But if the child is already 3 or 4 years old, even one vaccine is enough. One dose is enough. In only the young ones, because they're not so good at making the antibody yet, so we give one dose, we give a second dose 2 months later, and then we give the third dose is about a year later. Some pediatricians insist on giving all the 4 vaccine. 1 month, we give 1, 2 months, 2 months, and then only 1 year later. They have done a lot of studies, and I attended the talks where they presented all these papers from Europe, from everywhere, even from Malaysia. They did the study that if they give 3 vaccines, the 3 doses of the vaccine, they get 92% antibody. If you give all the 4, they get 98% antibody. So to me, you know, since the disease is not so common, it's not so prevalent, if you're 92% protected, oh, cukup lah kan, you save 250 ringgit. What was the other question? Does he answer all your questions? Yeah, okay.
Are there any other questions? Yes.
Assalamualaikum.
Waalaikumsalam.
I'm actually from Bangladesh. I have migrated in Malaysia like 6 years ago. So the problem is like my wife has a problem when always she's sneezing. Now my kids are also like sneezing. Thing is like I think my wife has dust allergy.
That's what?
Dust allergy.
That's allergies. Okay.
And then my kids, I'm observing like the kids are staying in school all the day in the like high, I mean very cold air conditioning room. So they will have, I think 80 to 90% time they will have flu. And then sometimes my second kid will have like fever, vomiting, and if she starts vomiting, she will vomit in every 30 minutes. Just 30 minutes or 20 minutes after, she will vomit. But nothing can stop the vomiting unless, like last time we were visited the clinic, the doctor gave suppositories to stop the fever. So I have 2 questions, like how I can decrease the flu and improve the flu conditions for my both kids. And for the second kid, when she starts vomiting, the vomit like continuously. Is it the perfect medication for giving suppositories?
Yeah. Okay. How old are the children?
The first kid is 10 years, and the second one is 6 years already.
Okay, so that's easier to give treatment then, you see, because if they are infants, then we don't want to give anti-flu, anti-cough, all those things, so we avoid doing all that. But if they are bigger already, then we can give some medication. But actually, the best thing would be if you have a air purifier at home, you put an air purifier, you know, if you have. If not, just make sure that there's no carpets in the house, your curtains are, you can be can vacuum clean it so the dust is not accumulating. So, but it is impossible to keep the house, even if you stay in a nice palace, there still be dust, you see. So you can't really, and of course avoid having pets that's got fur like cats, dogs. You can have goldfish, so it's okay, you see. So, but in school you cannot control because the teacher, I mean the school actually install the aircon. If they don't put the aircon, then parents complain, my child in school is very hot, you know, they're sweating away. So you have to maybe you can avoid by staying in the area where the aircon doesn't direct its air. Other than that, actually, you have to encourage a child to eat food that has got high vitamin C. It's no use in giving tablets and pills and then you eat all sorts of junk food, you see, because those junk food will destroy your body immunity and your own protective mechanism. So my advice to some of my patients has been actually, you drink sort of plain water, add a little bit of ginger, add a little lime or lemon or limau kasturi, and then add a bit of honey. After all, Rasulullah SAW also encourage us to take honey. It's got protective anti-infection. So this drink, you say drink twice a day, in the morning and in the evening. 1 cup in the morning, 1 cup in the evening. This will increase the immunity, lessen the amount of flu, and if you get the flu also, it's not going to be very long. Now, once they get it already, then the idea is actually to decrease the congestion in the nose. So there are actually simple antihistamine medicine to stop the congestion, or even just nasal spray, just to spray the nose to decrease the mucus secretion, and lots of fluids to drink, because lots of fluids to get your body well hydrated, you see. Once you start vomiting already, then you've got no choice. You have to give anti-vomiting medicine. But if vomiting once or twice a day, it's okay. Don't have to worry about that. If you're vomiting 10 times a day, then you are worried about the child getting dehydrated. So those ones you can give the suppository, because if you give oral medication, it doesn't work because the child will vomit it out. You see? And you have fever medicine by suppository, and you got anti-vomiting medicine in suppository form. You see? Anything? Answer your question? Yeah. Okay. Good.
Are there any other questions? We have 15 minutes. So anything that you want to discuss?
It can be other conditions if you want to ask, not necessarily. This is what I picked up in order to give you the
Assalamualaikum, Doctor.
okay, salam.
My question is, if a child misses compulsory immunization at an early stage or early age, now he is standard 3, Doctor. Maybe he might take that.
Yes. You can take at any time. Even you and I, by right, we should be re-immunized because our body has forgotten. So now we have got a project. The government is, the pediatrician sort of recommending to the ministry, so that you recommend some the bigger children immunization or adult immunization. Because if you got whooping cough and you got a little baby at home and you give the whooping cough to the baby, imagine it will be very devastating for the baby. But you cough, you're an adult, it's okay, is it? So you can get immunization, but it's slightly different from the children. Usually the dose is half because we just need to stimulate your immune system. So that and also not every disease need to be immunized. We usually don't give you for mums and those kind of things, but definitely we can give you some type of immunization which we know that is commonly in the community. So if the child says standard 3, so has he missed all the immunization or some?
1 or 2.
1 or 2, you can always give it. Anytime your pediatrician should be able to give it. No big deal.
I've got a question. I hear that some vaccination contains non-halal things. Do we ask the doctor before he gives vaccination to our children about it? Or do the doctors advise the patient before they give this vaccination?
Most doctors do not advise it. And because most doctors would have read some papers or would have inquired already about from fatwa, from whatever, you see. So in the Ministry of Health, they said you can give, you see. So the council for the yang bagi fatwa tu said you can give. It is not of course the compulsory one. I'm talking about the compulsory one. When we say compulsory, basically these diseases are so severe, if you don't take it, when you contact the disease, you'll die. So that's compulsory, is it? Yang optional too, sometimes the ministry of think that, well, it's not really that compulsory, I mean, you get the disease, you may be ill for a while, but you don't die from this disease, you see. So they don't recommend it so much. So that's generally what the pediatrician. Most pediatrician would like to give the immunization because they want to protect the whole crowd rather than just one particular child. They want to give it. So if you have what we call herd immunity, which is 80% of the population is protected, then the 20% doesn't matter so much, you see. They will be protected because they are surrounded by the 80% who are protected, so they don't get the virus or the bacteria. Now, I have heard from Abdul Rahim McCarthy. So I heard one of the YouTube. So he says these are so minute and they are just fraction, not the whole pig that they put the virus in. You see, this is just some of the maybe the collagen or fraction of the protein. So say they take the protein of the pig from whichever I don't know the exact process. Then they break that protein to get certain portion of it. Then they grow the virus inside. But they don't give you that particular virus or that particular solution. They wash it many times, and then only they got the final product. So it's only the initial product that has got the pig DNA. The pig protein, but the final product doesn't have it anymore. So he said it is okay to give the vaccine. So that's why our imam, our fatwa group in the Malaysia also said we can give it. You see, initially the meningococcal yang pergi Mekah tu, there was no halal one, you know. So it was given to everybody because in order for you to go to Mecca, you have to have this vaccine. It's compulsory. You don't have this vaccine, you will die in Mecca, or you come home and you give it to your grandchildren and your grandchildren will die. So they make it compulsory, and tabung haji quietly give lah. It's only lately ni that they have got a new meningococcal vaccine that doesn't contain the pig DNA. So that's the short answer lah, you see.
Yeah, I know vaccination is very topical at the moment, especially when TB Al-Hijrah had a debate between Dr. Musa
and Dr. Musa,
and one of the GPs who is an anti-vaccine. Anyway, I just want to find out, any of you here don't vaccinate your children? Because I just want to know, as doctors, we're just interested in knowing your thoughts.
Yeah, what's your opinion? Is
Yeah,
it?
what's your opinion?
Is it very dangerous that we...
Yes, as I said just now, certain diseases are dangerous. If you don't vaccinate against diphtheria, recently so many deaths against, with diphtheria. So, but if you don't vaccinate, katalah rotavirus, which is the one that causing charet beret, kan? So that one too, if your child get charet beret, you just go to the doctor, put IV drip, give all this kind of treatment. Usually the child is alright, they don't die. You see? Inshallah lah. Those days they used to die. You see? And measles also, generally speaking, they don't die, but severe measles, they have got severe complication with pneumonia, with meningitis, with encephalitis, then they can also die. It's a certain condition when it is very severe, they can die. So certain diseases, yes, it may be quite mild. Like, okay, influenza. Influenza is a vaccinable, immunizable disease. So we advise parents to give the vaccine, but it's still optional. It is not compulsory yet. Now, if you don't give your child influenza vaccine, it's okay. The child get very bad influenza aja lah, and then cough and get admitted for 1 week. The child better. You go home. They don't really. It used to be death because of the H1N1. Initially, the H1N1 was very virulent because it came immediately from the pig, it goes to the human being. So the human being not used to this particular H1N1 lagi. So when they contact this the disease, they become very ill and they die. But as years go by, this H1N1 is now going from one human to another human to another human. They become very mild already. They are not so strong anymore. So now if you get H1N1, you cough lah, tak apa.
No, your question about vaccination, I did not allow any of my 3 girls to take the vaccination for cervical cancer.
Cervical cancer. For cervical cancer, yeah. But that's not compulsory. Cervical cancer.
No. You're wrong.
Huh?
It's already compulsory by the government. In school now, every child receives the vaccine.
Oh, okay. also not
I think it's form 3 ke apa ke? Anybody got big children? Tak ada.
Yeah, okay. So Dr. Indon has corrected me because I didn't know. When I went to school, it was not compulsory.
No. Recently.
Yeah, because cancer of the cervix is different. I mean, we are talking about childhood illnesses. Cancer of the cervix, because it's the second most cancer in this country for females after cancer of the breast. So that's why now the government has made it compulsory. And most studies, a lot of studies have shown that cancer of the cervix is related to the papilloma virus. That's why there is now vaccination to prevent cancer of the cervix because of this papilloma virus which causes cancer of the cervix. So when you vaccinate, you protect your body against papilloma virus. So inshallah, you reduce the risk of cancer of the cervix.
Yeah.
So. But anyway, we are talking about childhood illnesses, so that is a separate matter altogether. But what I don't want to say is that I just want to echo what Dr. Indon said, because she's a pediatrician, I'm an adult physician, that even in adults, when we talk about medications, there is a sort of heparin which is of porcine origin, which is low molecular weight heparin, which we sometimes give patients if they have increased clotting tendency. Yeah, so we as adults will tell patients, as adult physicians will tell patients that this heparin contains porcine origin. But as a doctor, I will also tell my patients that in Islam, that is for us, we need to be educated about religion as well. So for us, we tell our patients that in terms of treating the low molecular weight heparin, we have a lot of opinions. Although it's porcine origin, there are a lot of opinions to say that it is halal. Because I attended a talk before by the Dean of UIA, University Islam Antarabangsa, Professor Omar Kasuli, when he was educating the doctors about, I know he put a lot of dalil evidence, but I can't remember the dalil. But the bottom line is, as he said, in Islam, you must look at the process. For example, the low molecular weight heparin is of porcine origin, but in the period of processing, it becomes halal. Because even though there is peak DNA, but like Dr. Indon said, it is processed many times. So the end product is no longer haram. He also quoted an example for us doctors to explain to patients. For example, like grape. Grape in Islam is halal. But when you in the process of making into wine becomes haram. But when you process it again to make into malt vinegar is halal. So it is the process of how you go to make the end product that makes it halal. So that's why as doctors, as a professor of medicine, he gave a talk to us doctors to explain to our patients why low molecular heparin, although it's porcine origin, we should educate our patients to say that it is not haram, because it is to treat their medical condition, which otherwise can be lethal. So similarly, like vaccination, insurance, it is very important because you want to protect the whole community at large, like Dr. Indon said, to confer herd immunity. So again, I would like to allay the fears of parents, because I'm sure a lot of you read Wikipedia. Somebody actually forwarded through WhatsApp what is actually contained in Wikipedia. But I tell that person that you cannot trust everything you read in Wikipedia, because it is not evidence-based. And anybody actually can contribute to Wikipedia. But you all may be educated, you are nodding your heads, you know that you cannot trust Wikipedia. But I'm just going to tell you what is written in Wikipedia so that our expert here can explain why the fact in Wikipedia is wrong. So what it says in Wikipedia is that some vaccines have fetal tissue. So that's why in a lot of religions, vaccination is not permitted because it has fetal tissue. So can you explain that, Dr. Indon?
Wah, yang tu I do not know the details of how the vaccine is prepared from the fetal tissue, but these are not real fetus. Maybe the fetus that has been aborted or taken, whatever, so the tissue is cultured. So it's not from the baby directly, they take the tissue, see? That fetus that was early on aborted, they maybe take the tissue and they grow the cells, and then once the cells is grown to, then that they use as the media to culture any virus. Previously, people used to use egg. For example, when they did measles vaccine last time, they used to grow it on egg. So children or babies who are allergic to eggs, they cannot have this measles vaccine. And they used to test the baby was by eating a small amount of egg they put on the skin and see whether they reaction or not. But now it's not necessary already. So they also do R&D a lot in this vaccine arena, and different vaccine has been produced, and different techniques have been used to produce the vaccines. Yeah. Other questions? Anybody has taken the well, I know Dr. Haslin said we don't want to talk about the HPV, but anybody has taken HPV? The ladies? Anybody else? Yeah. So parents ask me to explain why, doctor, because they come to me